These types of jobs have been associated with adverse health outcomes, including heart disease. Less educated workers also are less likely to have health-related benefits. So to unpack that a little bit, first off, obviously with lower income jobs, less educated workers having fewer health-related benefits, it's kind of been partly addressed by the Affordable Care Act, because now folks can go to those marketplaces and buy plans there with benefits that are separate from their employers. But the issue of stress from these jobs is still an issue. New York and Los Angeles, they both have policies for their police officers where that even if a police officer has like a heart attack or a stroke off the job, like when they're not working, they still get like financially compensated for it as if it was a work-related injury. Kind of an acknowledgement that stress over time builds up to negative health outcomes, not just like some single traumatic event like the death of a family member, for example. So it's a real problem that we have these jobs where folks are getting stressed out every day, and it's having long-term health impacts. It's cumulative. All right, so that was the income variable. We'll move into the neighborhood variable now to look at kind of unpack that a little bit more as well. The two things I was really interested in with that were public transportation and access to healthy food. So there's a report from the Victoria Policy Institute, and they looked at Portland, Oregon. And they looked at neighborhoods there and kind of studied the public transportation options that were available there. And basically it found that neighborhoods that have both a good public transit system, like buses and trains and whatnot, and also have good walkability and that are designed so that they're kind of centered around and focused around public transportation stops, so that when people are living in those neighborhoods, they're like aware of the public transit stops instead of just being like off to the side over there or something. Those kinds of neighborhoods tend to have more people walking, bicycling, and using the public transit system than neighborhoods that just have a public transit system alone without good walkability. And then obviously both of those kinds of neighborhoods have more walking and bicycling and less automobile usage than neighborhoods that just don't have any public transportation at all. And so obviously public transportation is encouraging more exercise, but obviously you can't really, in some cases you can't really walk, to a supermarket that's 5 miles away, which is why I kind of tie public transportation and food access together, because in some cases you're going to need public transportation to get to a healthy food outlet. Kimberly Moreland and colleagues, they have a study they did of neighborhoods and the number and types of food locations within different neighborhoods. And they found that there are fewer households in poor and black neighborhoods that have access to private transportation methods like automobiles. So obviously here at Drake, like a lot of people do have cars, so they can just drive to the grocery store. But in these kind of neighborhoods, they often don't have a car, so they can't necessarily drive to a supermarket that has the high-quality, nutritious food that you really should be eating. Instead, oftentimes they'll end up just walking to the corner convenience store and getting like processed food, like a donut or something, which I love donuts, but probably shouldn't be a main part of your diet. So public transportation and healthy food access are kind of tied together in that. So public transportation is more about the design of the neighborhood and how people can get around, and the healthy food is more about kind of like the resources that are available in that neighborhood. And both of them explain how the neighborhood variable ends up impacting health outcomes. And then finally we move into the race variable, which we kind of started to touch on there a few moments ago. First I want to talk about racial residential segregation, which basically means that we have a situation in the United States where, despite civil rights, obviously, and integration and whatnot, we still have the different races, African American and white in particular, that are just living in totally different neighborhoods. One study found that around 60% of African Americans would have to move to white neighborhoods in order to actually have a balanced integration of or to have 50-50 black and white in American neighborhoods. So we have heavily tilted neighborhoods racially. And so here's one thing. There was a national study done of housing discrimination a few years ago, and it showed that blacks, Latinos, and Asians that were looking for rental units were told about fewer available units than comparable whites in 11, 13, and 10% of cases. So we see implicit bias there. And then during the housing crisis, back during the Great Recession, mortgage companies like Wells Fargo and Countrywide, they would market the subprime mortgages, which were high-interest loans for housing. They would specifically target those at minorities, and since minorities already generally tend to have lower incomes than whites, it was kind of a pretty raw deal. And so the reason why I bring this up is because, one, home ownership, owning a home allows you to accumulate wealth, and as I've said numerous times, more income helps with better health. And then the other reason is because when you cluster together minorities that don't tend to have as much income in specific neighborhoods, those neighborhoods end up being disadvantaged, having lower property values, and not attracting the kind of resources like the healthy food stores that are needed to sustain a healthy lifestyle. Okay, yeah, and so I move into stereotypes and stress. And so with stereotypes, I found it was quite interesting. There was a study done that showed that it got to refer to the handout now again. Turn your handout to the last page, that top figure. Basically, they took Stanford students, both black and white Stanford students, and they gave them a verbal test. And the diagnostic condition on the left is the instance where the black students were told that the test was it was going to be a test of their intelligence, that it was like, this is like testing your intelligence. And then the other case, the non-diagnostic, they weren't told anything like that, they were just given a test to take. You can see in the diagnostic condition, the black students performed well below the white students, while the other one is nearly identical. It's really quite striking. So what I concluded from that, basically, based on the literature, was that the black students incorporated this corrosive stereotype that they're less intelligent and not as able to intellectually perform or achieve academic success. And this is not good, obviously, because as we were talking about earlier with the income variable, having more education allows you to earn more and work a better job, and obviously have better health resources. So these stereotypes, even though they might not seem like they're that big of a deal, you should just brush it off. If people end up taking it seriously, whether they know it or not, it can really have a real difference on their educational prospects, and then their income prospects, and their health prospects down the road. Oh yes, and of course stress, of course, as well. So, talk about stress with the income variable. It also applies to the race variable. In both cases, I'm talking about stress in the workplace. And in the workplace, we find that there's still a fair amount of workplace discrimination where, for example, Elizabeth Deitch, she has a 2003 study on workplace discrimination, and it basically found that she didn't even ask for instances of racial prejudice in the workplace. She just asked, do you feel like you've been mistreated, or, basically, do you feel like you've been mistreated, or how many times, like, what specific instances and whatnot. And basically, blacks end up reporting more mistreatment on the job and less job satisfaction, even without the prompting for, be like, hey, what racial prejudice is going on. And that kind of mistreatment on the job, where folks feel like they're being discriminated against, is a source of stress that, as it builds up over time, it results in negative health outcomes, similar to the issue with low-income workers feeling like they don't have control over their jobs and they're not really doing something worthwhile. All right, so that basically laid out the groundwork. We went through the theoretical models for how these social determinants work, and then we kind of looked at some of the real-world mechanisms for how they're producing health effects. Now I want to offer a solution. Multiple solutions, really. We don't really have anything to hand out, but so I will start with some education policies that will help us out. My first proposal is that we institute a nationwide universal preschool system, which I think is long overdue. Basically, research shows that the brain, from about 3 to 5 is a peak period of brain development where we really should be taking more advantage of that critical young age when you can be really taking advantage of that really prime time for brain development. But unfortunately, we don't have a universal preschool system, so a lot of folks who aren't in preschool are just sitting at home, like playing video games or something. It's not really taking advantage of that prime time for brain development, and it really hinders them for the rest of their life because if they had started early, they could have had that extra early brain development, but you can't really catch up genetically speaking afterwards, or you can catch up, but not to the extent that it makes up totally for missing that window of early brain development. So yeah, nationwide universal preschool system. And obviously you're asking, how do you pay for it? Because that's always the issue, although apparently we don't care about paying for things these days. But, at least not in Washington. But a report from the Center on Budget and Policy Priorities said, quote, overall state funding for public 2- and 4-year colleges in the 2017 school year was nearly $9 billion below its 2008 level after adjusting for inflation. So my proposal is that obviously some of that money needs to be restored to state colleges and universities, but I also think we should take some of that money and invest in a pre-K program, because if folks are getting that pre-K education, they'll end up having better educational outcomes throughout their academic career and be able to go to a better college, get more scholarships anyway. That will kind of offset some of the drawbacks of having less funding for higher education. So starting early is key here. And then, sorry about that. Also, we could just simply redirect some of the funding we're spending on elementary schools now to preschools. The Iowa Legislative Services Agency reported that $8,874 was spent per pupil in Iowa in fiscal year 2016 for elementary schools, compared to only $3,320 for voluntary preschools. So that's more than double that we're spending on elementary schools compared to preschools, but arguably the learning and educational development you're getting in preschool could really make a bigger long-term impact than what you see in elementary school. Oh yeah, and I also proposed you could have a race to the top-like program too to help fund the preschools, where local governments could kind of compete to get funding for these preschools. They won't have to rely totally on property taxes. All right, so the other education policy I had was what I call diversity training programs. So basically, I talked about the racial stereotypes. The best way I think to address those kind of stereotypes is to address it early as well in preschool before they're already ingrained, as we saw in that study of the Stanford students. So the diversity training program basically would just bring in, you could have career days, for example, where we bring in successful doctors and scientists and lawyers of different ethnicities to preschools to meet with preschoolers and show them, that, hey, you're smart. You could also have videos and picture books as well that kind of serve the same purpose. Yeah, so those are basically my two educational policies: a nationwide universal pre-K system and a diversity training program. Those will help address education. Next, I want to move into some more neighborhood-focused policies. What I recommend here in this case is that local governments be more aggressive about setting up farmers markets that can be set up in low-income neighborhoods where they don't necessarily have access to healthy food. And so what would happen, basically, these local governments, they would recruit farmers to bring in fresh fruits and vegetables to these farmers markets, and then to help subsidize the produce, basically, there would be sales taxes set on folks, because if you go to the Des Moines Farmers Market, you've got the fresh produce and stuff. You've also kind of got the cinnamon donuts and stuff. So basically, you would set higher sales taxes on those goods at the farmers market, and use the revenue from that to subsidize the offering of the fresh produce. I would think it'd be be wisest to hold it once a week, so that way residents could stock up on fresh fruit, vegetables, that kind of stuff for the week ahead, and they won't have to go to the convenience store to do their grocery shopping. And in order to make it easy to access these farmers markets, I recommend one that they be located near a public transportation stop. Like the Des Moines Farmers Market is located not too far from Dart Central Station, so a location will be key to make it accessible, especially low-income Americans. And then, even if you can't necessarily do that, you could set up a bus shuttle service where a bus would go around to like local parks, churches, schools, those kind of prominent places to pick up low-income residents and take them to the farmers market. So it's only once a week. A free shuttle bus service wouldn't be too much cost to the local government. So now I want to move into some policies I came up with to address stress in the workplace. And basically, my way of doing this is that in order to relieve stress, exercise has always been found to be a very effective tool. I know it myself from being here at Drake. It's always good to have a Bell Center. So, my first policy basically would be to offer a small business tax credit. Be a tax credit for small businesses if they purchase a single piece of exercise equipment that they could put in the back room or a storeroom of their store for use on an exercise break during like your lunch break, for example. So what I mean basically is like an elliptical machine or a treadmill. Basically, you give a tax credit to the small business, and they get a treadmill or an elliptical, and they can put that just in the back of the store, so the employees, when they're on a break, can go back there and use it. And of course, I set some limitations on it so that it doesn't cost too much. The tax credit would only apply in the first year when they actually buy the piece of equipment, because it doesn't cost too much to upkeep an elliptical or treadmill unless you totally wreck it. So that would be one limitation. The other one would be that small businesses could only apply for the tax credit once every few years, so they're not stocking up on a bunch of 15 ellipticals they don't actually need, and it's not draining too much money from the federal treasury. To pay for it, I actually came up with an innovative idea here. There's a 2014 report from the U.S. PERG Education Fund and Citizens for Tax Justice. It says that, quote, by booking profits to subsidiaries registered in tax havens, multinational corporations are able to avoid an estimated $90 billion in federal income taxes each year. And so basically I say, let's take that money and use it to fund this tax credit. The cost of the tax credit I found would be, even if every American small business applied for it, and there's 28.8 million American small businesses in 2016 according to the U.S. Small Business Administration, even if every small business applied for it, the cost would come out, assuming that the tax credit is $1,500, $1,000 for the treadmill and $500 to make it worthwhile for doing. I calculated the cost of the tax credit to be $43.2 billion, and so $90 billion from getting rid of these tax havens would more than cover the cost of that tax credit. So that was my first idea. The other idea is a little more less ambitious. It would basically be having local governments do a better job of strategically placing city bicycle racks near business areas where there tend to be more low-income workers. And the way to do this is, on the handout, you can see the last figure. It's an equity atlas, and basically it's a useful tool that you can kind of plot out. It's a useful tool for showing the relationships between different determinants of health and the well-being and geography of a region. And these things can include things like income and jobs. And so basically the local governments would collect data from the residents of their town and neighborhoods about, where do you work and how much do you make. And then based on that information and based on where businesses are located, they can kind of pinpoint where the low-income workers are mostly concentrated, and then place the city bicycle racks near those businesses, so that they're mostly focused in those areas. So then low-income workers can go and they can use the bicycles to go to or from they're home or during their lunch break, I would recommend having a kind of a happy hour where, like, during the lunchtime window, like 11 a.m. to 1, that the bicycles are actually, like, free for use. I know Des Moines has something like that. So, okay, so I have two more things here. We have the racial residential segregation that I talked about earlier. There's already a policy underway to kind of address that, but I have a few tweaks that might help out with it. The Department of Housing and Urban Development has a housing choice vouchers program, which basically gives vouchers to low-income families, elderly people, the disabled, to help them buy homes in the private housing market. And it's administered by what are called public housing agencies, pretty simple, PHAs. And basically they tend to have a backlog on these things. There's a lot of people who want these vouchers to help them get a home. So there's always tends to be a backlog with the public housing agencies. And they have what are called local preferences, which are these preferences